So this is really interesting data, and I apologize, the link for the story, this is a story that came in the Irish Times. It's a brilliant story. I read it, and I recommend everyone Googling this, because what it looks at is the Republic of Ireland compared to the United Kingdom. And if anyone who is kind of following the news realized that UK was a little bit slow in introducing physical distancing measures. They were slower than what we did in Canada. And initially there was a thought of, should we let herd immunity actually take over and not close down businesses, not shut down schools and things like that. And whereas the Republic of Ireland followed more of a Canadian model of instituting those measures earlier on, we can see the case fatality ratio is actually quite low at 5.9%, similar to many other countries, whereas UK is much higher rates. And then what this article did was they then explored the Northern Ireland, which follows more of the UK model of having delayed their social distancing, compared to the Republic of Ireland, who did institute physical distancing. And what you can see here are deaths per million people, and you can see that Northern Ireland, day after day, did worse by not quickly and early doing physical distancing, following the model that happened in the UK, and unfortunately what's happened in the US as well. And again, it brings us back to this article in the Washington Post, which I really encourage everyone to read, because it really does explain why we want you to be this stationary dot. If we had done nothing, if we had been slow to institute physical distancing in Canada, I would be presenting a lot more ominous numbers week after week. We would have overwhelmed our healthcare system, and we would have had a number of significant challenges in managing COVID in Canada. And in fact, we have flattened the curve. If you look province to province, most of the provinces have been able to manage our cases within our healthcare system. Being a stationary dot has bought us time to expand resources, to understand new treatments that are being tested, and to get a better sense of what it means if you have inflammatory bowel disease and you have COVID. And that time is going to make us much smarter in treating this disease a month from now, 6 months from now. So again, being a stationary dot means that you're protecting society, and it's also meaning that you're protecting yourself.